meeting to order. This is a meeting of the Personnel Committee of the Board of Health. The time is now 6:37 p.m. Committee members present are Joe Clark,
Joe Morosky,
Lupe Ortiz,
Cecilia Carmen.
and Kyle Markinson here as a board member, is here as a guest, and a representative from the Finance Committee. Is there any public participation before this committee? Hearing and seeing none, we'll move on to approval of minutes. Julie, would you like to make a motion in regards to the minutes from the Personnel Committee meeting that was held on
I will move to
on October 25th?
October 25th. I will make a motion
Should
to
we-
approve the minutes.
Wait,
of
November 14th.
Oh, we did October 25th.
Pardon?
Okay,
We did-
well, all right, I was going off the agenda.
Yeah.
oh, you know what you're looking at? I think you're looking at the agenda that's part of the minutes, not, that's the minutes.
Yeah, 'cause I think
This is the agenda.
Oh, okay,
So
gotcha.
Yeah.
November 14th.
So,
Gotcha.
okay,
My mistake. Minutes from the November 14th, 2022 meeting.
I'd move to approve the minutes from November 14th.
Do we have a second?
Second.
Motion's been made by Ms. Morosky, second by Ms. Carmen. All those in favor of the motion signify by aye.
Aye.
Aye. Those opposed say nay. Motion carries, minutes are approved. The next item of business is new and unfinished business. How we're going to handle this is I'm going to recognize Administrator Adamson to give the introduction on the topic, then I'll entertain a motion for approval in a second, and then we will, as committee members, have an opportunity to ask questions, offer comments, and discuss the topic. So let's start with Melissa with item 4A, resolution adopting title changes to existing McHenry County Department of Health positions within the Division of Environmental Health.
yeah, so if you recall, previously we had created a STEP program within the Environmental Health Division, and this is really just to align that system, align the titles with the system so that it's clear. So we will just be streamlining those titles to Environmental Health Practitioner 1, 2, and 3. And if you look at the resolution background information, Patty put this together and defined what that means. So an Environmental Health Practitioner 1 is someone who is yet to be licensed. So they have the background, the experience, they meet the requirements of the position. The law does require that they get, or the statutes require that they get licensed within 3 years. So once they could walk in licensed and then they would be an EHP too. But many of our EHP staff walk in and they're not yet licensed. So they get the experience, they take a test, they get licensed. So then they automatically move up into an Environmental Health 2 position. From there, after 3 years of experience, then presuming somebody wants to take on the additional responsibilities, they would then be moved into an Environmental Health 3 position. And there are grade changes for each of those. And those grade changes have already been established. So this is really just aligning the title changes to the system that's already in place. If anybody has any questions, Addie or myself?
I was just curious, because for solid waste specialists and groundwater, is it just wherever they come at, that's what level it'll be, 1, 2, or 3?
Where they're at right now.
Yeah, okay, all right, because it doesn't have a number next to it, so I wasn't sure if the position needed to have a 1, like you needed to have the, environmental practitioner 3 to hold that position, or no?
maybe I don't understand your question.
Okay, so on the form, it says like current position title, solid waste specialist, proposed title, it just says environmental health practitioner. The other ones say practitioner 1, practitioner 2, practitioner 3.
Because some of them we had already changed the titles, but the solid waste specialist, right, Patty, we haven't changed that title.
Right,
And then
but,
in training, we've been calling them environmental health practitioners in training, but we want to change that to environmental health practitioner 1. Because
Okay.
some people they don't understand what we're calling in training. And so it's getting confusing, or could cause
Mhm.
confusion if a food establishment is like, why are you sending me somebody who's in training?
Yeah.
They're qualified, they're trained, but we had just named them in training, and now we want to change it to environmental health practitioner 1, and I'll let Patty jump in.
yeah, so the groundwater protection specialist and the solid waste specialist were not positions that required licensure.
Oh,
So they
okay.
could have been licensed environmental health practitioners in training. So I put it as an environmental health practitioner, they would slot into what their qualifications are, you know, per the rest of the system in place.
Oh, okay, all right, I was just curious. Okay, makes sense.
Cecilia, would you like to make a motion to put this on the table?
So I'd like to make a motion to approve the resolution for adopting the title changes for the positions of environmental health.
I'll second.
Okay, now we can further discuss it. The environmental health practitioner position, as defined, what grade is that at?
EHP 1 is a 7N, EHP 2 is an 8N, EHP 3 would be a 9N.
7 and 8 and 9. Okay, what is the solid waste specialist and groundwater protection specialist? What grade would they be at?
Well, they would be whatever that person that's selected fits into that. So they would just go into the system. So currently, our groundwater protection specialist, who just replaced someone who retired
Mhm.
last week, would be an EHP 1. And then the groundwater protection specialist is the same. But the the solid waste specialist that just left was an EHP 2.
Okay,
So they're not tied to a grade level, they are tied to the work that they are doing. But the reason we want to generalize them is because we've gotten away from specializing and gotten more into the generalists, so that they're all really assigned geographically, so that all of our staff can respond to all types of activities and on-demand activities, et cetera. It's more efficient.
okay. I just see what Cecilia was questioning. It looks like that position is a different grade on a permanent basis than the 1, 2, 3. What you're saying is that it's a title for a position, and you reserve the discretion of whether putting them into the grade for 1, 2, or 3.
Right, commensurate with their either licensed or unlicensed and their level of experience, correct.
Okay, okay with that?
Yeah.
Thank you.
Mhm.
Okay, I have no further questions. Anybody else? Motion's been made by Ms. Carmen, second by Ms. Borowski. This is a motion that is attached to a salary, so therefore we need a roll call vote, please.
Okay, Ms. Borowski,
Yes.
Ms. Ortiz,
Yes.
Ms. Carmen,
Yes.
Mr. Clark.
Yes. The next item on the agenda is the resolution authorizing compensation for bilingual skills for the McHenry County Department of Health fiscal year 2023 budget. And I will turn that over to you.
Okay.
Make an introduction.
So, I think everybody has been at least at 1 or 2 meetings where we have discussed this. I would say the primary thing that has changed, after further discussion, is instead of the recommendation being a stipend, so the amounts that we're recommending have been unchanged. So for interpretation, it would be $3,000 and $1,500 for translation, and somebody may get both if they do both, if they pass the test. The difference being adding it to the base pay versus paying it out as a stipend. And actually, when we spoke with HR, that is preferable. It's a lot less paperwork than processing a stipend every year. It benefits the employee because it will grow a little over time. And that's I would say that is the primary change. We did check with county finance in terms of how the stipend would be taxed. There was some conversation, if you recall, about paying out in one lump sum. That would get paid out at a higher taxable rate according to the finance response that I received. So after further conversation, we're now recommending that we add it to the base pay.
Anything more?
I think that is the primary change. And then, really nothing else has changed from the previous conversations. People will be required to take an exam, right? An oral exam for the interpretation and a written exam for the translation. They have to meet certain criteria that will be designated internally, operationally, based on what we need.
So that the board members can discuss it, is there a committee member that would like to motion to approve this?
I'll move to approve the resolution authorizing compensation for bilingual skills in the County Department of Health budget FY 2023.
Very good. A second?
I will second.
Okay. Do any committee members wish to discuss?
Yeah, I have a quick question. So if we do annual increases, this wouldn't affect their annual increase, correct?
No, actually, so where I said it actually benefits the employee, if we do stipends, the merit or annual increase would be based on their base pay, not the stipend. By adding it in as part of the base pay, whatever the percent is that year for the increase would be calculated off of that additional 3,000 or that additional 1,500 or additional 4,500, depending on if they're interpreting, translating, or doing both.
Right, okay. Yeah, I just wanted to make sure, let's say that there was like a 3%, 4% raise and that, well, they already got a 1%, so we'll just give them a 2% to equivalent the 3%. I just want to make sure it was separated of what it was, but included in obviously.
Right, and so for our existing staff, right, this would get added to their base pay. Then as new people come in and we establish bilingual designated positions, or we're replacing somebody, who speaks Spanish, and then ideally, recruiting somebody who speaks Spanish, then they would get that added to their base pay after they are onboarded and pass that test.
And would it be like, would it start once they pass the test, or would it be retro for the year, or how is that gonna work?
You mean for the new folks? So this one, for everybody who's here,
Yeah,
we're proposing it's retroactive back to December 1.
okay. that's
For
what-
new staff, I think it would be effective,
Right.
The first pay period or something after they
Alright.
pass the test. We would have to operationalize that.
Okay,
Because the expectation then, or the requirement is for anyone who's receiving this, that they will be interpreting and they will be translating.
mhm. Sounds good. Looks like one more question. Yeah, it seems better than now it's in the base pay. It really, I think, alleviates a lot of the questions that, were coming up at the board meeting, so.
In regards to the question on could this potentially affect a merit increase or cost of living increase? Under the last several years of this board, we have chosen to recognize all employees equally for their merit increase. Not so much for their performance in their job, but to try to keep them in line with the increase in cost of living. And we've fallen short on that in that we don't have, with the parameters that are given to us by the county, we can only do so much. But I will call it out, identify that in the past, and it could return in the future, because it's a merit increase. In the past, the money came through the board and was sent to the departments, and then they determined how the merit increase was awarded, with some getting no rate increase and some getting maximum increase, and anywhere in between. So I just, as a new board member, I wanted to call your attention to that, so that if that ever does happen again, you'll say, hey, wait a minute, that shouldn't have happened. It can potentially happen. And so that's my comment there. Staff and I have discussed this at great lengths, and I am not on board with staff's recommendation. Although I have said, and I will stand by my commitment, that this language as proposed, I will vote in favor of. I want to get this issue to the full board and get it adopted so that our employees that will be recognized with this additional compensation can receive their money. But before I do that, I want to have a conversation with the other board members on some of my concerns. The method in which we are doing this, in my opinion, our wage schedule and our salaries, wages, and even to a certain degree some of the benefits, is substandard and comparable to other jurisdictions of similar responsibility. So I am with the employees in saying, hey, we should be compensated better than we are. Staff is working very hard to try to change that, but boy, it's a tough nut to crack. They just don't want to budge. The issue that I see in the method that we are doing this, by putting it onto salary, we are recognizing somebody for special skills. But instead of recognizing them on special skills, we are incorporating it into salary to try to make it more satisfying that they have a better salary. And yes, those employees are going to earn more money. But we also have many, many employees in our department that are also at a substandard salary. And they are going to be, their salary is going to be left behind in this type of action. In conversations with Melissa, the loggerhead that we reached, that we agreed that we weren't going to come to a solution, was the department, the directors, indicating the employees want the money over 26 pay periods. My intention was that it would be paid at, well, my first goal was if it was something that is required for a job, make it part of the job description, advance it in a pay grade, and pay that employee accordingly. Those that are in that grade get paid. Those that want to move to that grade can prepare themselves. When a vacancy occurs, they get moved to that grade, and then they move up in that grade with their merit increases, etc. Staff has indicated that the county will not do that. They are not willing to take job descriptions and put it as a requirement and move people in grades. Then it was recognized that, okay, if a new employee comes in They are not gonna start at the beginning of their grade. They will be moved up their grade by staff if they have bilingual qualifications. And the department has determined that those qualifications are necessary for the position that they want. My concern is, yes, next week, people are gonna be happy. These people are gonna be happy. I think there's gonna be some coworkers that are not gonna be so happy. But these members of our workforce will be happy, and they will have some additional compensation. And they'll probably say thank you, and they'll say, we appreciate it, we're happy, we're good. But this is gonna get rolled into their salary, and it'll come into their bank account every pay period, 60, 70, 80 bucks. 3 or 4 months from now, it won't even be noticed. It'll be just part of their income, part of their salary. 2 years from now, you could probably ask many of them, hey, how much are you getting extra? Oh, I'm getting paid $35,000 for my job. We are trying to reward a talent, a special skill, by incorporating it into the pay scale. I think that's a mismatch. I think either you put them in a grade for that talent, or you recognize them with a stipend, and you pay that stipend yearly. And once a year, a check is cut to them, they look at it, go, whoa, I just got paid so many dollars for my benefit. And every year that comes to them. It's not gonna happen. This county is so entrenched into their current pay program that they don't want to try anything different. Melissa has made the argument to human resources, to finance, etc., to try to get something done, and it just isn't getting done. So I wanted to throw that out there that I'm giving up on it. I'm not pursuing it anymore, but I don't think this is the right way to do it. There's one other thing, and the employees here probably aren't going to like what I have to say. And I am a pro-employee person. I want people to be paid what the comparable data is. I want them to be happy here. I want them to be here for 20 years. So don't get me wrong with the message that I'm about to say. But this has all come out as a result of employees challenging the integrity of our county administrator, of our county human resource director, criticizing the motives and actions of our department administrator. And now we are responding by adjusting salary in this manner. When there are, again, many other employees of this department that have not done so, have been part of the day-to-day activities, doing their job. Each and every person has some type of special skills that they offer the county, and we're not doing, with this policy, anything for them. And so there's my thought on that. It's like we're rewarding employees at this point in time that raised issue. And that is a little concerning to me. I am further concerned with the policy is it's not uniform. In other words, if you speak Spanish, you don't automatically get it. You are tested, you may be tested for it, and you may get it, but there's no guarantee that you will get it. If the department determines your position is not a needed position for bilingual language, you won't receive it. It's not an across the board, I tested successfully, I'm entitled to it. You have to test successfully, and the department has to identify that the position that you're in needs it. Again, if you want to go that route, put it as part of your job description and put that in a pay grade. If you're going to make it like an optional thing, the employee doesn't have to have it, but if they do have it, some are going to get it and some may not get it, and I have a little bit of concern about that. I truly believe that when this goes into effect, everybody here that tests will get it. I have no doubt in my mind that the motives of our administration is to make sure that everybody gets this compensation. But that doesn't mean that in the future it will stay that way. You know, as budget crunches happen and such, that's not something that is utilized to conserve expenses. That's basically all I've got on it.
Only thing I'd say, I wouldn't, okay, as someone who speaks Spanish, and, okay, if there's a position where you normally, I would assume a position where if I knew Spanish, but they didn't need it because I wasn't in front of clients, I wasn't in front of the public. I would be very happy, because you know what's happening now to that person? They're in their office trying to do their job, and they're getting pulled because there's no one else who speaks Spanish. And now, they don't, my job doesn't cover it. They can say, no, I'm sorry, I need to just focus on my job. So that could be a win for that person who's not in front of the public or have to speak Spanish daily for that. But yeah, I agree with you. Yes, it'd be nice if there was stipend every year, but this is what we have, and I just appreciate all you guys, because it's not just the Spanish, it's that you understand their culture, and that they can hear it more than one time. Because that's, you know, just especially working in the hospital, you're that Spanish-speaking nurse, and I mean, I've explained, you know, all these intense neurosurgeries to these patients, and that was the one time they heard it. And that was it. And then the patient has the surgery, and then I'm like, what happened? And they're like, I don't know, I heard it once. So I really appreciate what you do for all our people here in Kent County. So thank you.
And I'll add, you know, I agree, I think it'd be nice to be added it into the job description. As an executive director to an organization, I add it to all of mine, but that doesn't mean that we're gonna find people who do. That's where it gets really difficult, right?
So I want to clarify, we are going to be adding, but we're not going to, so we have to balance on the recruitment side to say bilingual preferred. If we say bilingual required, we have some concerns that if we cannot fill that position and we hold it and wait for a Spanish speaker, that it could impact operations. But I think the intent here is that for all the positions that we could utilize a Spanish speaker, we would absolutely add. I don't see us really taking away unless there's some major demographic shift, right? So some of the initial positions on here don't necessarily include an animal control officer. Patty may get lucky and have a couple environmental health, you know, practitioners that she wants to add because they'll go out and have direct interaction. So I think we want the flexibility. We will put them on job descriptions. On the recruitment side, we're going to say bilingual preferred. In the job description, there'll be some combination of bilingual preferred, but if you pass the test and this is a designated position and you are being compensated for it, then it will be a requirement of the position. It's just balancing the requirement on the front end from a recruiting standpoint and limiting our ability. On the county side with regard to grading, it's possible that maybe sometime in the future that's going to change, but right now it's it's why we're doing it within the grade versus reclassing it to the next grade up, right? That is a process that is controlled by the county.
Yeah, and I would agree with that. I think, you know, we added on there and we put it's preferred, and it's gonna be needed or might be needed if the skill level is there. But again, it's not as easy as it's required, because then we're stuck with maybe not filling a position. But if the potential candidate has it and is capable of utilizing it, then the compensation is there, right? Going back, Joe, to your comment of your concern of other skills, right? Like we're recognizing a special skill set. I think if there's other skill sets that are being used as much as Spanish speaking, I would encourage other employees to bring it up, right? If there's a skill set that is being used as much as this skill set specifically, I would encourage it. I think that, you know, that we want to recognize skill sets, special skill sets that are utilized to this extreme. We had commented on our other board meeting or at our general board meeting, other languages. I think other than that, you know, we don't want anyone to feel that other language are being discriminated, or that we're not going to do that. If we get to a point where our county is at that level where that other language other than Spanish and English are being utilized, and I think that that's where we bring it up again, right? Because it's reaching a population, it's reaching clients, it's reaching individuals in our county that are difficult to reach, and that there's language barriers. So to your concern on that, if there's other skill sets that are being utilized to that extreme, then I think it should be brought up to the county.
And I will also just add in terms of the process with the county. So now that the county is going to be doing a compensation study every 2 years versus every maybe 5 years, every position has something called a comprehensive position questionnaire that has to be completed. So while some of them have Spanish listed, right? If there are other skills, that's where we have the ability to ensure that if there are updates and there are additional skills relevant to that position, let's say, we would add them there, and then they would get graded accordingly. They go over and get scored and make sure that they're grading accordingly. But yes, I agree. If there was some kind of, I'm not sure what that would be right now, right?
Right.
I agree with you in the sense that like the most ideal is for it to get incorporated into the position and get scored accordingly. I think in this circumstance, you know, staff have been doing this for, you know, I'm gonna say since the health department opened, or since we had our first Spanish speaker, right? But it's never been recognized, it's never been accounted for, it is a skill set, it's critical, it's essential for serving our clients. And so while we might not be able to get it done in the way that we think, right, or the ideal way, this is a mechanism that we can acknowledge their contribution and their special skill set. So, and I think from the beginning, you know, what we want to have happen is that this does happen, right? So that it's fair, it's equitable, this is an additional time and talent that is required every single day to meet and serve our clients to the best of our ability.
And I would like to add that I firmly believe that the employees of the health department who aren't being compensated because they don't have the second language won't hold it against the folks that do. I mean, as a person that doesn't have a second language except bad words of German, I always so appreciated those folks, you know, and so I would be, personally, I would be happy, and I'm pretty sure
I believe
knowing our
there is a
staff.
lot of support. Other staff have
yeah.
supported their fellow coworkers, right? I mean, they have come forward. They have been participating in meetings together. So I believe the support is there, and I'm not I'm really not expecting, for lack of a better term, like backlash from people that, you know, now I want this too.
Right.
Yeah, and I think, right, I think that the support is there because they've utilized them in one way or another, and those individuals with that special skill set have been helpful, right? I don't think that will happen, where you say, no, I'm not gonna use my Spanish. It really is, on the contrary, that it's utilized all the time, and we're always willing to help. And so I think the support is because of that. You guys have earned that, and because of how helpful you guys have been, and it's a baby step to letting you guys know how much you guys are appreciated. And I think that if we do have those people, then we go back and we say with that wording, I really think that wording will help. It's a special skill set that is utilized at this capacity, and hopefully we can have that capacity in case we do have some people that have negative things to say or opinions on it, that we're not compensating a special skill set, we're compensating a special skill set that is utilized at this capacity. And if there's other skill sets that are being utilized at that capacity, that we encourage them to come forward and express their concerns with us, and that we're here to listen. But I think they'll be more supportive, but just those that don't, I think we can. It's not the only organization that does a compensation because of language.
And I think the staff knows that we're working hard to beating our heads against the wall for getting them a living wage. Every
Yeah.
baby step is a baby step, and it may be very baby, but
I agree
we'll never give up on trying to.
that our bilingual employees deserve financial recognition. I'm concerned with how we are recognizing that, as I've previously stated. Let me ask you this question. I'm a Polish-speaking employee. Now that the system's in place, I'm a Polish-speaking employee. We have a resident that comes in and speaks Polish. And they, hey, Joe, come on over here. So-and-so needs to tell us something. How should I respond to that?
I think that. How would you respond to that?
I know how I personally would respond to
So
that.
that's already incorporated in.
That you have a option to use a language line.
No,
No.
we have the option, so if we know somebody speaks
Oh, yes, okay.
speaks Polish, German, whatever, we can also have them tested and sort of be on standby and ready. Should a Polish speaker come in to the counter and need help with something, this person's already on a list of approved interpreters, let's say. So then if we call upon them, instead of calling on the language line, they're going to be compensated at the rate the language line would pay.
Okay.
And
So
that's already baked into the
I
resolution.
did read that in there. I didn't understand that you were gonna test all languages at this time, so that they would be eligible for that. I thought that,
Well, I think the testing, I think that's, again, sort of an operational decision about, do we have a perceived need or an actual need, right? That I'm trying to think of, a language that might be obscure that, although Susan has brought up Ukrainian a couple of times, I guess we'd have to consider whether or not we had a Ukrainian-speaking person and how often we would utilize them. But I think we'd have to know what's going on to really feel like we needed to test somebody, right? Like, do we anticipate that we're gonna need that language skill? But if we did, then yes, if somebody came, needed to communicate in that language, then that person would be paid out on a per minute basis, the same as the language line
So
bus.
I guess then the bottom line would be that data collection and how much and what the threshold is for another language before you start compensating them routinely instead of
Exactly,
per diem
yep.
thing. And so maybe start
Well, and I think
thinking
we
about
said
how-
we would continuously be collecting data because as demographics shift, right, we may need a different composition of language speakers.
Right.
How much do we pay the language line for?
It depends, it is based on, and I don't have that handy, Susan, do you know off the top of your
Yeah,
head?
I believe it's like $1.50 a minute for Spanish. And it's $2.50, it can be as high as $2.75 for other languages. Ukrainian,
$1.50 a minute?
a minute.
Okay, so $1.50 a minute, you're in a 60-minute
She's done the calculation.
meeting, it's, yeah,
Susan's
they're
got
not getting paid.
When we look at our stats, it would cost us over $350,000 to use the language line.
Oh,
For
Spanish.
For Spanish speaking.
A year
mm,
versus paying the employees at 79.
mm.
So with that, like other languages could get paid at a higher rate, for that language, that skill set of that language. But unfortunately, Spanish is just such a high demand that it's just impossible to pay at that rate that the language line would afford. So again, we're sorry and thank you for what you guys do. You guys are not, that's a lot of money.
Still doesn't answer the question of what the Polish-speaking employee, how they should respond. Do they say,
Well, they wouldn't, oh, so if you're saying like, would that Polish-speaking person be right at the front desk? I think, whoever's at the front desk would probably have to figure out what language they're dealing with. And then we would have an internal list that we would maintain at Health Administration, and we could say, okay, you know, Mr. Clark, we're gonna get somebody to help you. Kyle. Somebody would call Kyle who speaks Polish, right, and bring them over or get them on the line to do that translation.
would he be compensated for that translation without being tested?
No.
Okay. Since employees need to know that.
Right, and, you know, they know about the language line now, so they know
Correct.
tapping in, but yes, that is part of what we have discussed in part of the policy is we would have a list, that list would be shared, and employees would know who they need to contact, but they would go through the, you know, the directors and the
Okay,
divisions.
so testing will be other languages also.
Correct.
Okay.
Just a question, is the criteria the same throughout the whole department as it is for medical? You know, like for medical, you have to have a certified interpreter, translator.
Right.
But for like general conversation,
Right, when we talk to the company, the contracted company, when they're classifying medical interpretation, they're saying that's at a high level that we would not be doing, like the somebody going into neurosurgery and you're explaining the consent and what's gonna happen. With what we explain and, you know, at the level that we explain, they made a recommendation at what level, and it does not require a medical certification to do that.
and then are the regulations or laws requiring you to use a certified interpreter for every interaction?
No,
Isn't it
they don't have to be certified. We just the law requires that we have somebody that has competency and proficiency
Okay.
in the language.
Okay.
Now, in the hospital, it is different, where
Right.
there's certain things that you do have to have a medical
Right.
certification.
Yeah.
What we do in the health department does not rise to that level. If it did, and there was a concern about them not understanding what we were saying, then we would definitely call the language line and use the medical interpretation that's available on the language line at that point.
Yeah, I wasn't clear as to how far the law goes as far as general interpretation. You know, like, for example, if I just walked in and I spoke Mandarin, you know, I just wanted to say, hi, how are you? What time are you open or something? Do you have to have a certified person in that? No.
That's just general
Right.
information.
Any further questions or comments? Okay, we have a motion on the floor, and it's been seconded. Motion's been made by Ms. Borowski, seconded by Ms. Carmen. As this is a resolution that involves money, it needs to be a roll call vote, please.
Ms. Ortiz?
Yes.
Ms. Carmen?
Yes.
Ms. Borowski?
Yes.
Mr. Clark?
Yes. Motion carries.
Mr. Chairman, may I make an observation?
Sure.
Just, again, most of you know me and Kyle, I'm the chair of the finance committee, and for anyone who's not aware of this matter, this topic has gone around several times now. And what I really enjoyed being here to see this is a lot of the same questions, a lot of the same concerns, a lot of the same impetus to move this thing forward and to try and understand what's the best way to fashion it within the constraints that we're faced with. There's a lot of different topics that have been brought up, and I just wanted to point out that like, it is really heartening to see, though, that the concern is the same, that everybody wants to support this mission, that we've been grateful that we have staff that provides this service without compensation prior to this, despite that our peers around us, you know, in a lot of cases do compensate it. We've looked at the pros and cons, we've looked at the double-edged sword in both ways, you know, like, well, what happens if you're not, you know, if you're not being paid for it, but you have the capability, you just not provide the service now, we've talked about that. Finance committees had this twice, it's gone back to the board, it's been, you know, sent back here, which is great, because we're having this conversation. And the one thing, you know, I'm impressed that this went from something that I didn't think, you know, I think really Susan brought this to my attention, and there's a lot of staff, the time that's been put in this, the administrator's time, divisional directors, you know, obviously staff cares about this is great. And it's great to see everything working together, and I was impressed that county was open to this, that human resources, county finance, they were on board with this, and so after all of this, the laboring, you know, we wish it could be better, we've talked about discussions about how much it is, or how it should be more, and it is beefed up from where it started. It has been moved along each time, and I remind myself, let us not let perfection be the enemy of good. This is something, and I'm grateful for it, so thank you to your committee.
I will speak on behalf of the Personnel Committee and inform the board as a whole at the next board meeting that we unanimously endorse for the board to approve this and send it to the county board for their consideration. Is there any reason to go into executive session?
We still have the bilingual pay policy.
Oh, I'm sorry. Thank you. That's not in here. Oh, it's here.
It's 4B1.
Yep. Would you like to do the introduction?
So, I mean, I think we covered some of it just through the conversation, but basically, we have drafted out a bilingual pay policy outlining, you know, the components of the policy, the procedure to designate a position, testing, compensation, and then sort of overarching administration of the policy.
Okay. In my mind, I had both of these topics together.
The reason we have them separate is because the resolution, the bilingual pay policy is not gonna go to the county. It's just gonna be internal, but it's gonna get incorporated into the personnel policy, so the personnel committee does approve changes to the personnel policy.
Very good.
Well, I'll move to approve the bilingual pay.
And a second?
A second.
Okay. Any questions or comments? Suggestions? Motion's been made by Ms. Morowski, second by Ms. Carmen, to approve the, recommending to the full board to adopt the bilingual pay policy as presented by staff. Again, this is related to finances, so it requires a roll call vote.
Ms. Morowski?
Yes.
Ms. Carmen?
Yes.
Ms. Ortiz?
Yes.
Mr. Clark?
Yes. Is there a need to go into executive session?
Yes, we have approval of executive session minutes.
Is there a motion of a committee member to go into executive sessions?
I'll move to go into the.
A second. Okay,
Second.
motion's been made by Ms. Morowski, second by Ms. Carroll, to enter executive session for the purpose of reviewing executive session minutes. All those in favor of the motion, signify by aye. Aye. Those opposed, say nay. Ayes have it.
Thank you.
Welcome. Are you coming out at all? What's that? Coming out to check the project? Okay. I'll be going, taking my wife to the doctor.
I just sat here, yeah.
I know.
It's a Langdon. Oh.
I'm gonna take prior out of school. Take a rock line.
Okay.
Maybe I can come by.
Ellis County. That's water.
On the doctor.
Fine. You still have what, February, March?
Oh, do a good job.
They're all stable.
You're like an average one, something. That's our new program, and then we have the double program. But yeah.
Hardly touch. Have you noticed the drops of water?
Like, we serve them in Hamlet, but yet we're located in.
Down in the brown level, it's in the nineties. These are the nineties up there. Right.
Oh, yeah.
Bye-bye.
I know.
Right.
Okay, the Personnel Committee has returned from executive session as a majority vote is back into open session. Any further business, or the next item of business is approval of minutes from the executive session. Does a committee member want to be recognized?
Sure, I'll move to approve the minutes from 3/15/2021, 3/31/2021, 4/19/2021, 10/25/2022, and 11/14/2022.
Okay, which of those minutes would you like to release to the public?
Oh, but, oh wait, 3/31.
Okay. Is there a second for that motion?
Second.
Okay, the motion has been made, and Ms. Morosky, second, and Ms. Carmen, to approve and release the executive session minutes from the Personnel Committee meetings of March 15th, 2021, April 19th, 2021, October 25th, 2022, and November 14th, 2022, and to approve the minutes remaining in executive possession from March 31st, 2021. All those in favor of the motion signify by aye.
Aye.
Those opposed, say nay.
Nay. Oh, sorry. Aye. I said aye and then nay. Aye, sorry.
The ayes have it, motion carries. Is there a motion to adjourn?
I'll move to adjourn.
Morosky, second by Ms. Carmen, to adjourn. All those in favor, aye.
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 Those opposed, nay. We are adjourned.
Absent, no, just kidding. All right. Pay attention. Pay attention.